And increasing amounts of COVID hospitalizations are not only affecting hospitals and staff.
They could affect you if you're in need of emergency care. Officials with both hospitals locally explain the trickle-down effect COVID is having and why it's more concerning than ever.
Don't get in a traffic accident and don't have a heart attack.
That's how IU Health's Dr. James Bean signed a message to Tippecanoe County commissioners Thursday evening. He was asking them to partner with the health department in doing what public health officials say is best for the community.
It was a little bit of a pointed comment that those typical illnesses and injuries that we depend on the healthcare system to respond to in a very rapid way are at risk of receiving that response.
Bean says there's a lack of staff, increasing COVID hospitalizations, and more patients needing other care. It's creating a lack of beds and wait times for those needing emergency care. Both hospitals are full and are taking turns receiving patients by ambulance. Indianapolis can no longer accept transfers.
The hospital healthcare system in our region and even throughout the state is at its limit.
Franciscan Health Lafayette's Dr. Daniel Wickert says staff exhaustion is playing a part in the shortage. They've only been able to replace half of the staff that's left.
People are just saying, I cannot do it again. I need a break.
Both hospitals have already limited the number of elective surgeries requiring a hospital stay. IU Health Lafayette had to reschedule all of those Friday.
We are going into the weekend full with patients waiting in our emergency rooms for hospital beds where we don't have beds.
Wait times are becoming a problem in the ER, but hospitals are doing their best with what they have.
The nurses are trying as hard as they can. The nurses are working extra hard. And so please be kind. Please be kind to them. Please be considerate of them.
Bean says COVID patients are filling up beds and staying there for longer in order to recover. With the majority being unvaccinated, he says one solution to the problem is obvious.
So if you're contemplating it, please make the decision. If you've been vaccinated, encourage somebody else to take that step. Go with them.
Both Bean and Wickert want to remind people that the emergency department is for emergencies only, especially when it comes to COVID-19 testing and minor injuries. Most non-emergent care can be done at urgent care facilities.